Brad Zebrack is no stranger to USC, having been on the USC faculty in the School of Social Work. Before he moved back to University of Michigan, we traded him. There was a trade here. Steve came to us, Brad went there. Brad is really a unique breed. He is a academic social worker who has really been devoting his life recently to the whole field of AYA oncology. He can explain that, and has really become the foremost spokesperson and researcher in the area of the psychosocial aspects of AYA oncology, which, as you know, is a very unique area for this population. So it was really a pleasure to get Brad here to speak today, and using the language of the patients that we deal with. I think his topic of cancer sucks is a good topic. This is, if you talk to the young adults, you'll hear their language and how they feel about this, and Brad has become an expert on understanding this area. So Brad, welcome.
Great. Thanks, Stu. First, let me promise you I have no line graphs or bar charts in my presentation. And I definitely want to thank Dr. Siegel, Dr. Tripathi, Dr. Gruber for the invitation to be here today. It's always a great opportunity to come together with friends, colleagues who've done this work for years, and to meet new colleagues and new friends who are moving forward and addressing this issue. Yes, Stu mentioned, this is the language of the young adult, and what I want to do for the next 25 minutes or so is share with you a little bit about what it's like to be a young adult, and then what it's like to perhaps be a young adult with cancer. And in order to do that, I really want to share with you the language and some of the words derived from young adults themselves who have gone through this experience. So first, let's talk a little bit about what is it like to be an adolescent or young adult. Think back to those dramatic years of high school and dating and proms and all that kind of stuff, and that can probably give you the first window into remembering what that's like. But remember, it's a time of life about establishing independence. And forming an identity, starting to be comfortable with who it is you want to be in life as you move forward. It's about the brain developing. We pretty much now have data to understand the brain and suggest that prefrontal cortex, that front of the brain that controls rational decision making, is really not formed until the age of about 25. So for those of you who've worked with teenagers or perhaps have teenagers yourself, and when they do something that we think is really stupid and we ask them why they did that, and what's their typical response? I don't know, right? Well, they really don't know, because it's all in that prefrontal cortex that is continuing to develop. So, understanding that is a critical component of being able to provide quality care to this population. It's about relationships. Intense friendships, intimate relationships, sexual relationships, and all sometimes for the very first time. Thoughts about beginning a family and actually starting a family, entering into jobs and careers, finding one's place in the world, making choices, making independent choices, and also having to suffer the consequences of those choices. These are all the things that are happening in the lives of teenagers and young adults. What else is it like to be an adolescent or young adult in the United States? We have data to suggest that 20% of females and 8% of males report having been sexually abused before the age of 18. These are also the young people that we see in our clinical care. And what's important to recognize is that some of the emotional or behavioral manifestations of that traumatic exposure in childhood or early teen years may not manifest until adolescence or young adulthood. So there may be implications of those early life exposures to trauma or abuse that may complicate therapy later on. They may manifest as unsafe sexual behavior, promiscuity, drug or alcohol abuse, or psychiatric symptoms, which can really complicate care. Talking a little more about substance abuse. It's the largest contributor to mortality and morbidity in the adolescent and young adult population. We have data to suggest about half of adolescents report having been drunk at some point in their life by the time they've been in 12th grade, and that 22% of 12th graders, 1 out of every 5 12th graders, report an event of binge drinking, which is 5 or more drinks at one time in the last 2 weeks. So again, starting to set the context of who are the adolescents and young adults appearing before us in our clinics, in our care. Let's talk about suicide. Suicide is the 3rd leading cause of death for adolescents and young adults aged 15 to 24, behind accidents and homicide. And a particular note, parental divorce and then parental remarriage has actually been shown to increase the risk of a suicide attempt among young girls. So another element to be aware of in the clinical care. Poverty. 21% of children under the age of 18 years live in poverty in the United States, and there's nothing special about the age of 18 that's going to cure poverty. A lot of those young people are going to continue to live in poverty as they move into their adolescent and young adult years. Poverty increases the likelihood of other health problems, not just for the child, but also for parents and other children in the family. So just imagine the stresses and the complexities for parents who are taking care of a child with cancer, another child in the family who perhaps has asthma, perhaps are dealing with their own physical health problems. Again, another complicating factor that we deal with in our clinical care. And social development is an important context to really take a look at in the care of adolescents and young adults, where peer relationships, social activity, social interaction is so critically important. Being involved with peers, developing healthy peer relationships is critically important for the growth and development and the long-term health and wellness for adolescents and young adults. So now let's talk a little bit about what it's like to be an adolescent or young adult with cancer. And in order to do that, I'm going to share with you some data from the AYA HOPE Study. This was a intramural study conducted within the auspices of the National Cancer Institute. It was a large population-based study of adolescents and young adults, the largest to date. Patients were recruited through 7 SEER recruitment sites. And a lot of this data has really been helpful to complement what we already know, the little that we do know about adolescents and young adults. Just briefly, the eligibility for this study were adolescents and young adults between the ages of 15 and 39, first invasive of a primary diagnosis of non-Hodgkin's lymphoma, Hodgkin's, germ cell, ALL sarcoma. Diagnosis was between the diagnosis had to be between the dates of July 27, 2007 to October 2008. So we're talking about 1,200 eligible patients that were identified. This was a mailed survey, consisted of a number of different standardized measures of psychosocial and quality of life health outcomes. But today I'm going to focus on the last page of this survey, which was an open-ended question. And it asked the young people to write and tell us anything about their medical care or their experience with cancer. So that's what I want to share with you a little bit today. Let's go. Let me try Archie's little thing here. Okay. Let's try this. Okay. One of the challenges we've had to date in adolescent and young adult oncology is recruitment. So here's a large population-based study. Other population-based studies with older cancer patients typically have much higher response rates. But given this was the first large-scale study, we're certainly happy with 523 young people. It's a large enough sample to do some interesting analyses. So of those 523 people who responded to the survey, about half of them, about 296, a little over half, actually wrote something on that last page. And on the right, you can see the breakdown in terms of age. Those who are responding to this open-ended item tended to be in their 20s and even into their 30s. More males than females actually had something to say on that last page of the survey. The racial breakdown, a little more than half were white, less than half non-white. 41% of those responding on that last page were married, and about a third of them had children. The median time since diagnosis for this group of respondents is 11 months. So they're just barely 1 year out of their diagnosis and treatment. And they had some very intriguing and provocative things to say. In terms of the analysis of this data, what we did is we started with a predetermined framework of cancer survivorship that comes out of work done by Julia Rowland, a developmental psychologist, now the head of the Office of Cancer Survivorship for NCI. And some of her work, they've looked at the research, and they've really indicated that impacts of cancer can really be described across 5 different domains. Impacts of cancer in terms of medical care and health care, in terms of the impacts in terms of side effects and symptoms, a psychological and spiritual realm, impact in terms of relationships, and finally an area in practical support. So I'm going to share with you what we know across each of these 5 different domains. In terms of medical care, some of the major issues that arise for adolescents and young adults in terms of the medical care experience is adherence to treatment. And we see challenges in adherence to treatment, not just in cancer, but across other chronic diseases and even acute disease. Things like adherence to taking their medications. And some of the challenges to that adherence really comes back to that cognition developing, with those cognitive capabilities not fully formed. We may see the young person who says on a Friday afternoon, do I want to go hang out with my friends, or do I want to go take go to my radiation appointment after school today? And they make that decision to go hang out with their friends, because in the moment, that just feels like the thing that they want to do. And I think in terms of clinical care and even parenting, I think sometimes our immediate response is, that's stupid. Don't you know what a risk that is to your survival and your ability to overcome cancer? I think that's the first gut response that comes from parents and adults in positions of authority. But remember, we're talking about young people who are in that position where they're oftentimes drawn between their peers and what their peers have to say and what authority figures have to say. And when it's a time in life where we're really trying to engage them as participants in their care, I think an approach that is clear and rational, because they know that afterwards they know they made the wrong decision. And I think just reinforcing in them the importance of maintaining the regimen can go a long way, much longer than coming down in any kind of a punitive or punishing approach. We also know that adolescents and young adults talk a lot about the fit within the health system. Archie just showed you that, that separation, and the AYA is falling in the middle. And it's so true. What they tell us are things like, when they're walking the halls of the pediatric units with the big bright paintings of the hippopotamus holding the balloons on the wall, or walking into that playroom with the little chairs that are the size of kindergartners. When you're a 6'1" basketball player, 17 years old, being treated for rhabdomyosarcoma, you're looking around and you're thinking, I don't know if this is the place for me. Well, then you look at the adult care context. What does the adult care context look like? It's often a community-based setting. There's a waiting room with the AARP magazines strewn around, and the young people have this feeling like, everyone in the room here is the age of my grandmother. So in either case, there's a sense of isolation, and that's one of the most often reported aspects of cancer by young adults, is this feeling of being isolated and all alone. In terms of relationships with healthcare providers, it can be very intimidating. And young people, and sometimes even their parents, have very little, if any, experience with the healthcare system. We're talking about young people who have parents, grandparents, and maybe even great-grandparents who are still alive. Many of them have never even been to a funeral. So this notion of serious health, serious disease, maybe they have heard stories of grandpa who died of cancer, but they don't really have any personal connection or experience in this area. And without that coping capability or past history of coping with something so dramatic, it really is a major challenge to them in their life. There is also reporting of this notion of mistrust in the system. When we look at the trajectory, how did these young people get themselves eventually to the oncologist? Many of them tell stories of having symptoms, an ache in their leg that the doctor told them, oh, don't worry, it's just growing pains. Or the symptoms of intense itching on their body, and they've seen a dermatologist, and they've been prescribed eczema medications, and they've been told to use special soaps and special solutions conditions, and then it takes about a year and a half till they finally meet an oncologist who says, oh, well, those are symptoms of your Hodgkin's lymphoma. Didn't you know that? Of course they didn't know that. So by the time they get to these oncologists, they've had a lot of doctors. They've had several doctors who perhaps have said to them, don't worry, you don't have cancer. You're too young to have cancer. So that notion of mistrust is very evident and needs to be confronted, I think, right away. So what else did these young people tell us in the HOPE study about medical care? Well, many of them were satisfied with the care. My doctors prescribed me with the options of radiation, chemo, or observation. I was able to make an informed decision considering my life plans, family plans, and future treatment. So satisfaction around that engagement and really being informed about their condition. But there was also an element of dissatisfaction among adolescents and young adults. For example, here's a young person who said, almost a year before I was diagnosed, I went to my primary care doctor because I felt something in my testicle. He said it was nothing. A few months later, I returned because I was throwing up blood and fainting. He said it was nothing and that it was all in my head, to go home, watch TV, that I was okay. A few months later, I was found with cancer, testicular cancer, and it had spread to both my lungs and kidney. So because of some careless doctor, I lost a kidney, a testicle, underwent 2 major lung surgeries, and lost half of 1 lung. So you hear the drama, the dramatic experience, expression of the experience in the words of this young person, but an example of just what I was talking about, this trajectory of people minimizing their experience. In terms of side effects and symptoms, young people they listed a whole litany of some of the symptoms that they've been struggling with, and the ways that a lot of these symptoms have really been a disruption in their life. Keeps them from going out and being with their friends is probably one of the greatest impacts and limitations of experiencing all these symptoms. I reacted so strongly to the side effects of my chemo that I wasn't able to live day to day without any assistance. So think about young people at this time in their life when it's supposed to be about going out and becoming independent, and yet now being forced into this dependence on family members, on friends, to drive them to appointments, to get them to where they need to be, and this notion of the sense of losing control over their lives because they have to be dependent upon people. My treatment was very easy with new anti-nausea medication and never being in the hospital for more than a week. So young people were satisfied when there was effective symptom control. In the psychological and spiritual realm, so remember, 296 people completed this last page, and there were about 35 people who all they wrote was "cancer sucks." And in a way, it just kind of summed it all up. Others went into a little bit more detail, talked about the challenges in managing the emotions and the stress of having had cancer. And it wasn't necessarily their own emotions that they felt challenged to deal with, but also others' emotions. Mom and dad, other relatives, other friends who either didn't know what to say or said all the wrong things. And this expression of feeling burdened by having to somewhat, manage everybody else's emotional responses to their cancer, which just sometimes led them to just want to go hide and not be around. They also expressed emotional responses with regard to losing their jobs, or losing time with their friends in school. Also about body integrity. How just the loss of confidence in their bodies was a strong component of this psychological and spiritual domain. A lot of them talked about the challenge to either establish or reestablish a sense of normalcy or maintain normalcy in their life. Again, for a teenager or a young adult, what's the worst thing? To be different, to be thought of as a different or misfit from your friends, to not fit in. Some of them described co-occurring struggles with drugs and alcohol. I'm not sure how effective we are being in our clinical care to either assess aspects of alcohol or substance use and to see how that might be playing a key element in therapy, adherence to therapy. And then a lot of them identified the end of treatment as a critical time point, where a lot of them experience unexpected anger or sadness or depressed feelings at the time of treatment being over. I know a lot of times we want to think about the last chemotherapy as a time of celebration because we're really happy it's all over. But I think we need to recognize that also in the mind of these young people, the end of therapy is also, there's anxiety and there's concern and worry about what's going to happen next. Here's some examples of what they said. I'm pissed at the universe and angry with my lack of motivation and energy. Since being diagnosed, I've not slept well. I feel depressed, scared, and constantly have a feeling of wanting to be home with my family. I was very social before, and now I don't do much. So incredible impacts in the way they live their life on a day-to-day basis. But there's a flip side to this, because a lot of young people, and it's not even a flip side, it's not an either or, because a lot of young people talk about both the negative psychological impacts of cancer while also talking about the elements of growth or the way that cancer has changed their life in a positive way. Cancer was a devastating experience, especially chemo days. But it changed my life. I became more positive, more health conscious. I exercised more. It allowed me to look at life differently. But every day I think about it and I seem very scared that it may return and I may not be strong enough to fight again. So Joan Hosse in her work has really identified two faces of the cancer experience. That one face is about celebration and hope, and yet that celebration and hope continues to often live within the context of fear and worry. In terms of impact on relationships, young people talk about parental pressures, this sense of overprotection. I think a lot of you in the clinical realm have seen this. But there's also this need to protect parents, but also to want to go it alone. You know, a lot of these young people have just perhaps moved out from their homes. They're found an apartment in New York City, or they're living on their own and really creating their dreams for the future, which even with this great challenge of cancer might mean wanting to go it alone, or maybe wanting to go it alone because they don't want to worry their parents. Well, when families can oftentimes be an important resource for support, this is something we want to engage young people in as they're going through their treatment. They talk about the social pressures that they experience, feeling different from their peers. In the dating world, this is a really key piece, or even in relationships. Who do I tell and how do I tell about my cancer experience? When do I tell? I've heard young people talk about, the very first date when I meet somebody new, I just put it right out there and let them know, because if they can't handle it, I don't want to be with that person. Others are a little more circumspect, a little more private and uncertain about when that right time may be. You have other young people, maybe they've just been recently married. They've just said those vows in sickness and in death, in sickness and in health, till death do us part, right? And when young people say that, what are they usually thinking? That ain't going to happen till I'm 60 or 70 or 80, right? And yet then they're confronted early in their relationship with these intense challenges. And how do they manage that in the context of their relationship? And about sex and sexuality, it's definitely on their minds. They definitely want to talk about it. They definitely need to talk about it. They find that their families are incredible sources of inspiration and support, as well as their friends, places of worship, God, as well as other cancer survivors. But they also suggest that sometimes they're not. I lost a lot of people who were very close to me. I disappeared for a couple months, and when I finally returned, everything was not the same. The people who knew my situation did not know how to approach me. I felt they had no idea who I was, and I wasn't too sure if they really cared. And here it's this example of someone in a committed relationship. My spouse did not express any interest in learning about my cancer. He was and is unwilling to talk with me about my feelings and my fears. So these are the ongoing issues that these young people struggle with, not even during, but even after cancer. Finally, in the areas of the practical domain, impacts on health insurance, financial burdens, not just the financial burdens that they may be experiencing on their own, but they're concerned that the financial burdens that they may be placing on their parents. They're concerned about health. How can they be healthy? What should they be eating? What kind of exercise should they be doing? Can they be doing, even in a somewhat limited way? For those of them who have challenges with substance abuse and alcohol use, where can they go for help with that? Disruptions in their school or work, how can they get back into those realms? And then concrete needs. How can I get to all these appointments if I don't have a car? Who can take care of my young children when I have to go in for hours of chemotherapy or radiation? How do I access disability benefits or support? Without warning, the insurance informed me that I had reached the lifetime maximum of $1 million under the policy. Currently, I have more than $70,000 of outstanding claims for which I am sure the service providers will start to request payment. How do I deal with this situation? How do I handle the fact that due to the insurance company not informing us in a timely manner that the coverage was nearing the cap, we could have taken steps to prevent the issue? What happens when a lot of these young people get those bills on a daily basis from the hospital? Actually, it's not just young people. I think a lot of older adults do the same thing, just in the garbage. It doesn't make any sense to them. It's too complicating. It's too stressful. And yet they don't understand the incredible implications that, the financial burden on them is going to have currently, but also in the future. And hopefully now with, the future transformations in healthcare, where, caps on insurance will be disallowed, we won't see these kinds of instances of, finances sneaking up on people. I cannot plan my life. I can work a little, but then cancer comes back. Then I go through hardship with money, childcare. You don't only have to worry about your health, you have to worry about the kids. Who's going to put them on the bus? Will you be alone and so sick if you cannot get out of bed and have to send your kids off because you cannot see about them? Also, are you going to be able to pay your light bill or mortgage all in the same month? And the doctors tell you not to get stressed. Here's the world. So I think what we really need to be thinking about is that understanding the behavioral, the social, and the environmental context of adolescents and young adults' lives is really critical for being able to deliver quality health care. We've got to understand the care within the context of the psychosocial growth and development because it has implications for adherence to therapy or the completion of therapy. It has implications for their ability to go home and manage the symptoms and the side effects of their disease. Impacts on the doctor-patient relationship. We know about the importance and the value of communication. So many young people talk about, feeling like they're the third wheel in the room because the doctor is just talking directly to the parents and not really engaging that young person in their own care. And yet doing that is hard because sometimes we beat our heads against the wall trying to get the young person involved in their care. We just feel that we're not able to do that. Around clinical trials, recruitment, retention, some of the challenges that need to be overcome in the future of getting these young people not only onto clinical trials or on our outcome studies, but staying in them. And then about clinical operations. So here's the future, and I'll conclude here, really thinking about AYA cancer care. I think some of the emerging literature and some of the potentials for research are suggesting that being able to keep young people involved in social activity and independence is critical. Helping them seek and understand medical information and manage the daily stress in their lives is important. Being able to cope with the treatment-related side effects, being able to come to some acceptance of their illness is important. Managing their emotions, like I said earlier, not only their own emotions, but the emotions of the people around them, and then finally being able to link into the support and resources that are out there and available to them. I want to thank and acknowledge some of my colleagues in this work, and I hope to be able to engage some of you in the audience in some of this work as we move forward in the future. Thank you.